reaching out to the United States. An old friend, Giselle Phelps, is joining us, a journalist. And Giselle, how are you feeling right now with Ebola in your backyard?
Yeah, well, I would say I'm concerned. I think amongst, people here in Dallas, Texas, there's a heightened level of concern. There's not panic. And I do think that we are questioning some of the decisions that have been made and the response of the U.S. government to the Ebola crisis in general. I think until now, it was really viewed by Americans as something that was happening over there in Africa. And I think people are now questioning, did the Obama administration respond too slowly? It was just in September when the president announced, troops were going to go over there to help combat the spread of Ebola. So, yeah, I think there's a lot of questions being asked now, and people are concerned.
Never mind, we don't at this point know very much about the patient, do we?
We don't know very much about the patient, but from what's being reported here in Dallas media, from what I understand, is that this patient came from Liberia to visit family. So from what I understand, this person lives and works in Liberia. So we don't know whether or not they're an American citizen at this point.
CDC has already come out and said that if you're on the plane from Liberia back to the United States, you're not at risk. It's just if you came in contact with them. So while this guy arrived on or person, I don't even know if it's a guy, but arrived on September the 20th, it wasn't really that date that's important. It's September the 24th to the 28th. Here's the key to this, though. Didn't he go to the hospital at one point?
Exactly. He did go to the hospital on the 24th of September with symptoms and was sent home. So obviously that is of great concern to people here in Dallas that, even despite what's been going on and all these screening measures that you hear about, that somebody went to the hospital, presented symptoms, and was just sent home with some medication. So that's extremely concerning. And also, Pat, I will tell you that the new news here that's being reported in Dallas this morning is that the Dallas County Health Director says there's a second person who had close contact with this individual who's being monitored for a possible second case of Ebola already just the next day.
Are they comfortable that they're dealing with it appropriately in the hospital there, Giselle?
Yeah, so, the hospitals and health officials have been doing a really good job of kind of conveying that message through the media that the general public shouldn't be worried that this person's in isolation. What's going on right now is what's called a contact investigation. So the CDC and Dallas County health officials are now kind of going out trying to pinpoint all the possible people that would have had contact with this individual. So aside from those folks, the word that everybody's really trying to get out is that the general public shouldn't be concerned. And actually, I've been hearing the media kind of try and put it in perspective, and they're saying that, medical officials are more concerned about the spread of influenza here in Dallas at this time of year than they are about the spread of Ebola. So that's what they're saying.
Be safe, Giselle. Great to see you again, though.
Great to see you, Pat. Thanks.
Giselle Phelps joining us.